Here is our other torso model. So we're going to start at the top, work our way down. So here is the parotid gland, which is one of your salivary glands. And then on this side, we have the submandibular gland. And then here under the tongue, we have the sublingual gland. All three of those are salivary glands. Here we get a good look of the hyoid bone. So there's the hyoid bone. From here to here, this portion of the airways is called the larynx, and that has your vocal cords, and it leads to the trachea, which we see down here. This gland here is the thyroid gland. This cartilage over the larynx is called the thyroid cartilage. The thyroid cartilage. The cartilage, once we get further back, changes its name to cricoid cartilage. So that's the cricoid cartilage. Down here, once we start getting into the cartilaginous rings, we are at the trachea. So this is the trachea, and these blue things are the cartilaginous rings of the trachea. The heart sits a little bit towards the left side. For that reason, the left lung is smaller, and it has only two lobes. It has the superior lobe, and the inferior lobe. Whereas the right lung has the superior, middle, and inferior lobes. In this model, the diaphragm is here. So this is the diaphragm. Now I could also take these off and ask for the diaphragm here. Okay, so that would be the diaphragm. This is the left subclavian vein and the right subclavian vein. They're taking blood from the arms. I've got the left jugular vein and right jugular vein taking blood from the head, neck, and brain. The jugular vein and the subclavian veins come together to form, this one would be the left brachiocephalic vein and the right brachiocephalic vein. The right and left brachiocephalic veins merge together to form the superior vena cava. The superior vena cava. I also have the inferior vena cava, which I'll have to show you after I take this off because it's kind of hidden back here. But both the inferior and superior vena cava are going to drain into the right atrium. Okay, under here is the right atrium. This structure here is called the right auricle. This portion under here is going to be the right ventricle. Then here is the left atrium and the left auricle and the left ventricle here. All right, so let's take this apart. So here is that inferior vena cava and superior vena cava. So both the inferior and superior vena cava are going to drain here into the right atrium. From the right atrium, blood is going to travel through the tricuspid valve. The tricuspid valve is attached to the chordae tendineae, which are attached to the papillary muscles that are going to ensure that this opens only when it's supposed to, and that it opens in one direction. When the ventricle contracts, blood will be pushed up through the pulmonary semilunar valve here and enter into the pulmonary trunk. The pulmonary trunk. The pulmonary trunk is going to split into the left and right pulmonary arteries. Okay, then it goes to the lungs, blood gets oxygenated and returns to the heart, and it's going to return to the heart through the right and left pulmonary veins. Okay, the right and left pulmonary veins are going to drain into the left atrium. From the left atrium, blood travels through the mitral valve or bicuspid valve and enters into the left ventricle. The left ventricle then contracts, pushing blood up through the aortic semilunar valve. From there, blood will enter into the ascending aorta. The ascending aorta. If you look very closely, you can see the first branches of the ascending aorta. One is here, that would be the left coronary artery, and here is the branch for the right coronary artery. The right coronary artery continues, and you can see that's continuation here on the outside of the heart. So that's the right coronary artery. And the left coronary artery is right here. The left coronary artery is going to split into the anterior interventricular artery and the circumflex artery. And the other thing you need to know here is the coronary sinus. The coronary sinus. This portion of the aorta is considered the ascending aorta. Once I get to the point where I have the branches off of the aorta, that point is the aortic arch. The first branch of the aortic arch is the brachiocephalic trunk. The brachiocephalic trunk is going to bifurcate or split, forming the right subclavian artery and the right common carotid artery. The second branch is going to be the left common carotid artery, and the third and final branch is going to be the left subclavian artery, which is here, the left subclavian artery. So remember, here is the trachea and the cartilaginous rings of the trachea. The trachea continues here. The trachea is going to bifurcate into the right and left primary bronchi. This is the esophagus again, and this is the thoracic portion of the descending aorta. And remember, this portion here is the diaphragm. We also saw part of the diaphragm on the base of the lung, like so. Here we see the liver. This is the stomach. Here we see the small intestines and the large intestines or colon. So let's take out the liver. Turning the liver around, here we see the inferior vena cava. So this is the inferior vena cava. This is the gallbladder in this model, the gallbladder. And the gallbladder is going to drain its concentrated bile through the cystic duct. Next we have the stomach, and we can see here that this is the esophagus. Now the opening, the connection between the esophagus and the stomach is going to be the cardiac sphincter or the cardiac valve. So this is the cardiac sphincter or cardiac valve. This is also the cardiac sphincter or cardiac valve. And the exit to the stomach, so that is the pyloric valve or the pyloric sphincter. Or I could ask you about the fundic region, which is going to be here. The cardiac region is going to be in this area. Body region is going to be here. And the pyloric region will be here. This is the pancreas. The pancreas. This is your spleen. And this is the other end of that pyloric valve. The first portion of the small intestine is here, and that's called the duodenum. The duodenum. If I turn it around, I can see more of the duodenum. After the duodenum, we get the jejunum. Much of the jejunum is behind this here. After the jejunum, we get to the ileum. After the ileum, then we start to enter into the large intestines. If I open this little thing here, this area is the cecum of the large intestine or colon. That is the cecum. If I turn this around, I can see this structure called the appendix. The colon has several regions. This first portion here is the cecum. This would be the ascending colon, the transverse colon, the descending colon, and the sigmoid colon is shown here on this model. The sigmoid colon continues here until it straightens out about here. Once it straightens out, at that point we call it the rectum. This is the right kidney, and this is the left kidney. At the top of both of the kidneys, these are the adrenal glands. This here is the abdominal aorta. The right and left iliac veins merge together to form the inferior vena cava here. Blood vessels going to each of the kidneys. This is the renal vein and the renal artery. Renal vein, renal artery. Urine is formed in the kidneys and then is going to go to the urinary bladder down here, and it's going to travel through the ureters. So here's the ureter, and here is the other ureter.